Well, good morning. Good morning. It is so good to see everybody. Welcome to Thursday. Good. It is good to see everybody. Good morning. Welcome to the 9th annual Hunger and Health Breakfast, an incredible partnership between Gleaners Food Bank and IBJ Media. My name is Mitch Frazier. I'm president of IBJ Media and just delighted you have chosen to invest your time to be with us this morning to have such a critical discussion, not just about what's happening as we collectively address food insecurity, but what can be done next. Together we come together this morning to address one of the most fundamental challenges facing our neighbors, and that's this intersection of food insecurity and health. Now, I know many in this room are deeply connected to combating food insecurity, and despite all the work that so many here are doing, here in this room and across our state and across our nation, more work still needs to be done. Indiana continues to grow, we continue to innovate, but the reality remains that more work needs to be done. At IBJ Media, we believe in the power of linking arms with incredible organizations to affect change, to bring about a better tomorrow. And this morning, I'm just honored, delighted to link arms with the team at Gleaners, Fred, you and your organization, to really have an important conversation and to shape this next chapter of combating food insecurity together. Gleaners is such an incredible organization. When you look at Gleaners, one of the largest food banks in America, distributing more than 100 million meals per year to 330,000 Hoosiers across 21 counties in central Indiana and in southeast Indiana. There's many in this room. Those numbers are numbers, but when you look at how those numbers are accomplished, it's extraordinary. Fred and the team of roughly 140 employees, 17,000 volunteers who collectively invest more than 64,000 hours per year. And it's because of those volunteers, because of Fred and his team, Gleaners is able to serve more than 300 local organizations, soup kitchens, schools, food banks, community centers. I want to personally thank Fred Glass. Fred, thank you for your leadership. Thank you for your work as president and CEO at Gleaners. Fred's leadership at Gleaners, when you look at what is happening, Gleaners isn't just about how do we feed those in need, how do we serve those in need. It's about shortening the line. How do we create durable, long-term impact? And this morning's conversation is going to be focused exactly on that. Not just what is happening, but what can happen, and how do we shorten the line? You'll hear from Fred this morning. Fred will have his keynote, and then we'll pause for breakfast. Then after breakfast, my colleague and friend, Gary Dick, host of Inside Indiana Business, president of our Inside Indiana Business division, Gary will come up and lead an incredible discussion with leaders shaping change in food insecurity. Now, at any time this morning, you want to learn more about the agenda, you want to learn more about the folks you'll see here on stage, want to ask questions to the folks here on stage, all you need to do is scan that QR code there at your table. On the back of your program guide, you can ask questions directly to the panelists. Also, while you're there, you can sign up to receive news from IBJ Media's suite of products, whether that's Inside Indiana Business, the Indianapolis Business Journal, or the Indiana Lawyer. Now, to kick us off this morning, it is my distinct honor and privilege and pleasure to introduce you to Gleaners President and CEO, Fred Glass. Fred, a visionary leader. We got to give Fred a little bit of background here. I agree, we can clap for Fred, but I want to talk a little bit more about this guy that we all know by name, but let me put a little bit of color. Let me put a little color around Fred. So when you look at Fred, an incredible attorney, had an amazing career at Taft. I think many of us know him from his work at the Indiana University, where he was athletic director and really focused on shaping transformation inside the organization. When you look at what Fred has done every place he has been, Fred builds a culture of outcome, builds an organization focused on leadership, and at IU we see it, a cultural and physical transformation that we continue to see results from today. But I'll tell you, my belief is Fred's most powerful impact that he has made in his career is the work he's doing right now. You see, this isn't just a job for Fred, this is a cause for Fred. And for those of you that know Fred, you know this to be true. Fred wrote a book not that long ago called Making Your Own Luck. And if you haven't read it, I encourage you to pick it up. In that book, Fred peels back the curtain just a bit and shares more about why this cause is so important to him. Fred recounts the story of his connection to food insecurity and his father, who would try to serve food insecure neighbors from his bar. Fred shares stories about how he remembers holidays having dinner with those less fortunate, bringing people in to ensure they had a meal to eat. That deep connection to food insecurity built the foundation of the man that you're going to hear from this morning. He's an incredible leader, a great guy, a friend. Please help me welcome Fred Glass.
Wow, that's very nice. Thank you. Good morning, everyone. It can only kind of go downhill from there. I'm a little concerned that I won't be able to live up to that very generous introduction, Mitch, so thank you very much. I appreciate it. I don't know if you can all see, but I've got this like really groovy little mouthpiece thing, and I've done this a few times, but I've never had this, so I feel very TED Talky and official. I'm telling my wife's president of the airport authority. I feel like the guy, bringing him in, so. Anyway, thank you so much for being here this morning. I love this event. I love the new event venue that we have, and it's such a great cross-section of our community. I'm really grateful for you to be here. I am going to try to set the table here a little bit and be mindful that I'm the thing between you and breakfast. Let's see if I hit this the right way. Oh, there we go. So, as Mitch said, this is our ninth Hunger and Health Breakfast. Unfortunately, there are a lot of things to talk about with hunger. Its tentacles run deep. We've talked about a lot of things with our panelists: national trends, root causes, the social predictors of health, public policy, agriculture, collaborations, partnerships. Last year about how businesses are answering the call, and as Mitch alluded to, today I'm really excited because we're going to focus on shortening the line. We talk a lot about feeding the line. Today we're going to talk shortening the line, and our panel are people who are out in the field shortening the line every day and helping our neighbors need our services less. It won't be news to you that we're living and continuing to live in an era of unprecedented need for people facing hunger. The government statistics continue to show 1 in 7 Americans are food insecure, 1 in 5 children. That's an increase of almost 10% from the year before. That's a record. It's unfortunately record on top of record. And these are the highest percentages in actual numbers in more than a decade. We crossed an unfortunate Rubicon here in Indiana. Now 1 million Hoosiers are considered food insecure. I like to say this, some of you have heard me say this before: hunger's not a them problem, somebody over there in that side of town doing other things. Hunger is an us problem. First of all, the sheer numbers, right? I mean, if it's 7 million, if there's 7 million Hoosiers and 1 million are hungry, 1 in 7 people are facing food insecurity. There's people in this room who have probably faced food insecurity or know somebody facing food insecurity. I guarantee there's people at your school, in your PTA, in your travel soccer league that are facing food insecurity. The numbers just tell us that. It's an us problem too, because the old canard that they're malingers waiting around for their free food is just wrong. 1/3 of people can't work. They're elderly, they're children, or they're disabled. But of the balance, those homes have at least one job in their household. When I'm working our pantry line and putting groceries in the trunks of cars, I'm moving aside work belts and safety helmets and work gloves. These are working folks who just can't make it, working people like the people in this room. 500,000 deaths a year are attributable to food insecurity. Most kids, this is crazy. The USDA tells us that most kids alive today will be obese by the time they're 35. That's crazy, and that's a nutrition-based challenge. amazing array of health problems associated with being hungry: reduced immune systems, communicable diseases, poor body weight, asthma, higher rates of anxiety and depression, more emergency room visits, overall poor health. I think we can agree that it stinks to be hungry for folks who are hungry. What I want to emphasize to you is that hunger is a challenge for those of us who aren't hungry. The non-hungry in society pay a price for food insecurity. $1.8 billion a year in additional healthcare costs are generated in Indiana every year because of food insecurity. Who pays that? All of us, right? Statistics show, this isn't a surprise probably, for every 1% the food security rate goes up, violent crime goes up 12%. People do what they feel like they need to do sometimes when they're hungry. Lower workforce productivity. I've always known about absenteeism. A new one on me is presenteeism. People are at work, but they're not really at work because they're hungry. And statistics demonstrate that there's real big numbers in terms of what business pays, passes on to consumers because of lower productivity as a result of hunger. Lower educational achievement. You won't be surprised. It's hard to pay attention in school when you're hungry. So you're less likely to graduate from grade school, high school, college if you're hungry. More likely to drop out. And that stinks for the people that don't get those degrees. But it's bad for society too, right? Because society has denied someone who potentially could be more productive if they had those academic credentials. So hunger is an us problem, not a them problem. I quoted those statistics, about 1 in 7. But we can get numb to statistics, right? Million Hoosiers, wow, that's a big number. But every one of those folks has their own story. And I have the great opportunity of every other month I spend a day out at our pantries visiting the people that are serving our neighbors in need. And I will tell you that every time I'm supposed to do that, I'm like, I don't have time to do this. I got all this stuff to do in my office. I really need to stay back. I don't know if you feel similar gravitational pulls into your offices to do stuff. But I go, and it's always the best day of the month, because I get to see our neighbors up close, and I get to see the people serving them. And in a time when we're told to be afraid of other people, and there's all these bad motives, and cable TV and talk radio tells us that there's all this ill will out there. These are awesome people. These are salt of the earth people, similar to the panelists that you're going to hear from today. But I was in Johnson County. They have a drive-through pantry like we do at Gleaners. I'm there visiting. There's a guy in a minivan. He's got his little hood up. His wife is like yelling at him. He's looking all freaked out. The kids are all crying, and I'm like, what's going on over there? And they said, well, he ran out of gas. Happens all the time. Imagine that, how close. It's hard for us to understand how close to the edge these folks are living, that they run out of gas in a pantry line. I was in Martinsville, told a story about the woman who comes in, very nicely dressed, nice car. She's got her little manila envelope with a couple of utility bills in it and her driver's license copy and all this. And she's like, I've never been here before. I don't know what to do. Turns out her husband was a doc. He left her. She has 4 children. Then he lost his job. No money coming in. She finds herself in a pantry line where she never thought she'd be before. The line is very thin. I like to tell that story too because people say to me, Fred, there's some pretty nice cars in your line, I don't know if these people really need this. We don't know their stories. And I'll tell you what, if you're going through the trauma and the challenge, unfortunately, sometimes of being in a pantry line, you need the food. Most recently, in terms of personalizing this away from statistics, during the last government shutdown, a lot of federal workers were being expected to work without getting paid, and Gleaners reached out to them, including our neighbors, the TSA at the Indianapolis Airport Authority. Have a great relationship with them. There's 350 employees of TSA at the Indianapolis Airport we offered them our Gleaners to Go service where they could order their food like curbside, pick it up at Gleaners, and at the first distribution of the 350 folks at TSA, 150 took us up on our offer of charitable food. Again, that shows how close to these are, fully employed. They don't make a ton of money, but missing one paycheck pushed them to need food assistance. And they're still, some of them are still recovering because during that time they took out a second mortgage, they ran up their credit card bills. The Federal Reserve tells us that 40% of Americans are one $400 unexpected expense from being upside down. And that often leads them to turn to charitable food, and we're glad we're there. So I got to tell you, I don't think this is likely to go away anytime soon. And the reason for that is, one of the things I've learned, I'm new to food banking, kind of landed from Mars, was surprised to understand that food insecurity is not about food. There's plenty of food. The system throws it away by the train car full every day as a matter of normal business. Food insecurity is about poverty. People are hungry because they don't have enough money to cover their expenses, and that's why I think the indicators are it's going to be here for a little while. Why? I think there's four basic things really driving this. High rents. High rents are killing people. They're challenging up and down the economic spectrum, but for people that don't have much means, it's more dramatic. Half the people who rent pay 30% or more of their income on rent. Economists say that's bad. That's too much money tied up in keeping it in your house. Of that group, half, so that's like 25 million that have 30%, half of them, 12 million-ish, pay 50% or more on rent. And I hate to tell you, but Central Indiana is ground zero for this, you guys. For the year most recently available, Indianapolis up to Anderson, the Central Indiana Statistical District, had the highest rent increase of any metropolitan area in the country. 27% rents went up. Expensive groceries. I don't need to tell you guys, groceries shot up about 25% in 2020. They've never come down. That stinks for everybody. You go and you see this costs this then and this costs this now. But I'm here to tell you it's more challenging, not surprisingly, with people who are lower income, who pay about 30% of their money, family income, on groceries. Those who have more means, probably most of the people in this room, we pay probably about 8%. So we may be all in the same storm, but we're in different boats. Expenses outpacing wages. Like I said, the folks that we serve, they're working, but the wages that they're paid don't keep up with the cost of living. The Brookings Institute, these fancy guys in suits and everything, came up with this idea, study of a living wage. And they determined several years ago that a living wage was $18 an hour plus employer health benefits for a family of four. Well, that's not a big number. That's like $36,000 a year. So try to get along with family of four at $36,000. Well, let's assume that's right. If that's right, almost a third, 30% of Hoosiers at work make less than that. And now Brookings says it's $21 an hour. That's still not a big number. That's like $42,000 a year. If you go to that number, almost half of Hoosiers make less than that, about 42%. So they're working, and even at these modest levels, they just aren't making enough money to pay the costs of living. And then finally, the decline in government support. And I'm not even talking about the issues coming out of the budget reconciliation bill, but already, both on the supply side, the demand side, if you will, we were losing government support. During the pandemic, Gleaners got about 20 million pounds of surplus food for those couple years from the federal government. This year we'll be lucky to get 4. We have either strategically weaned or been weaned off government support on the supply side, and that's ultimately a good thing. But on the demand side of what's going on with SNAP, Medicaid, and other things, that declining government support is going to continue to impact. So that's pleasant. Wow, that's going to get my appetite going. Thanks, Fred. Great. I came this morning to hear all that bad stuff. And there are challenging things. And I think the right question is, what's Gleaners doing about that? I want to underscore, notwithstanding all that, I'm not pessimistic. I'm very optimistic that there are things we can do and are doing, and you're going to hear from our panel about what they and their organizations are doing that should give us all hope and energy to address these challenges. So what do? We do two things. Mitch referenced them. We feed the line and we shorten the line. We need to feed the people in the here and now. I like to say that that's requisite but not sufficient, right? And it's hard because this isn't a monolithic population. Like I said, everybody's got their own story. They're in different places. They have different abilities to access food, but we do our best, and last year we provided about 55 million meals. That's a record on top of a record on top of a record. We do that through our pantry partners primarily, some of whom are represented here. Thank you for coming. Our on-site pantry, Gleaners runs the largest on-site pantry in the state. We have mobile pantries in places where bricks and mortar don't work. School-based pantries, I think we have about 70 of those. They're awesome. I was talking a little bit about what we did with TSA. We have our basically our curbside work that we do with our partners. I'm hoping Ben talks a little bit about what we're doing with GLIC. And just note that we have 4 distribution days. By far the busiest are Thursday night, Saturday. Why? Because people are working. But also we want to shorten the line, and I'm excited we're going to talk about that more at the panel discussion here. How do we do that? Well, there's 3 basic ways to shorten the line. One is advocacy. I'm up here bragging about how awesome Gleaners is and how much we feed people, and I see my friend Linda Broadfoot and Nora Spitznagel are here from Second Helpings, and you've got Midwest Food Bank and Meals on Wheels. You take all of us together, and for every meal we provide, the federal government at least used to provide 9. So it's the 800-pound gorilla. It's important to be involved in advocacy, and it can work. During the pandemic, the childhood tax credit pulled half of the nation's impoverished children out of poverty. It was bipartisan legislation. We can do it. Feed the line. By the act of feeding the line, we can help free up resources for people to not need our services in the first place because they can spend it on rent, utilities, so forth and so on. Again, hopefully Ben will talk a little bit about that as well as others. And then providing wraparound services that we're really going to lean into in the panel discussion. Help people with ancillary services so that they are in a situation not to be poor and be hungry. Okay. I'm not sure this is the best metaphor. I'm not that creative on technology, but I don't know about you guys, but I feel like this some days. You know, the elephant is all the stuff going on out there and all the challenges out there, and it can seem very overwhelming, and I can feel like a mouse. I don't have as much resources as I want. My ability to impact feels limited, and I can feel like that. But I encourage myself, and I'm encouraging you to not let it, okay? And we don't let it. And you may feel that way in your professional work. You may feel that way, you know, with things going on in the world, things at home. But I want to give just a couple encouraging practice pointers, I think. We don't have to be superhuman to accomplish what we want to accomplish in serving people. I love this quote from Chuck Noll, 5-time Super Bowl champion. Champions are champions not because they do anything extraordinary, but they do the ordinary things better than anyone else. We don't have to be heroes. We don't have to be superhuman. We have to execute. We also don't have to become something other than what we are. And Claire Bobino-Fontenot, the head of Feed America, I love this quote at our recent national conference. We're not everything, but we really are something. Being ourselves is enough. We don't need to become something different. Rather, we just need to be the best version of ourselves. Mitch, that doesn't mean we don't innovate and evolve and try to be better versions of ourselves, but we don't have to be something different than who we are. And Claire does a great job of remembering that. The other thing I think is important is just because we can't do everything shouldn't lull us into not doing anything. And I love this quote from Mother Teresa: if you can't feed 100 people, then feed just one. I'm really impacted by my Jesuit education and the way of proceeding that Ignatius set out. And one of the things I love the most is this concept about the magis, or the more. That we need to bring the more. When we work hard, go all out. When we dream big. When we plan boldly. Give it the more. But Ignatius very deliberately didn't say the most. He doesn't talk in superlatives. He talks in comparatives. So don't let the fact that you can't do everything, that you can't always do the most, keep you from doing the more. And I find that, very encouraging as we keep fighting the fight against hunger. Thanks for your attention. I really appreciate it. I'm excited for Gary and the panel to share some of the things that are going on with Shortening the Line, and thank you for taking time out of your week to join us today. Thank you.
So we talked about linking arms and the power in linking arms and delivering what Fred just said is the more. And friends, you're going to hear about the more and about what's next. We'll do that right after breakfast. Enjoy fellowship, enjoy time together. We'll be back after breakfast with Gary Dick and the panel. All right, well, welcome back. If you're still eating breakfast, enjoy good food. How about a round of applause for the service team, the folks who put that meal together? Incredible work. Incredible work. It's so good when we can come together and enjoy a meal together and just spend time together. I love Fred's call to all of us. And that is, we don't have to do the most, we just have to do more. And when we think about doing more, this idea of shortening the line is absolutely critical. Something that everyone in this room can link arms and do is how collectively do we shorten the line. That is what we're going to discuss now. Here to lead the discussion is my colleague and friend Gary Dick. He's president of our Inside Indiana Business Division. Gary, many of you know, longtime veteran, reporter, business news leader in journalism here in Indiana, multi-time Emmy Award winner. Please help me welcome Gary Dick.
Mitch, thank you. Mitch, thanks very much, and good morning, everyone. Great to see everyone here this morning for what I think will be a very important discussion, as Fred laid out so very well, teed up our conversation in a great way. This is a discussion, I think, as Fred alluded to, that really does touch every community in Indiana, certainly here in central Indiana, but every corner of the state is impacted in a real way. Health, education, workforce readiness, so many facets of our economy are affected by hunger and the issues that we'll be talking about today. Gleaners Hunger and Health Summit is now in its 9th year, and I think that in and of itself tells us something very important, that hunger is not a short-term problem, but it is a systematic challenge that demands longer-term commitments, partnerships, honest conversations like the one we're going to have this morning. So our goal this morning is not just to better understand the problem and the issues that we face, but also making the important connection between hunger and health, and to leave with a clearer sense of what we can do together, because together I think we can accomplish great things, can change lives and change the trajectory of communities around the state of Indiana. So with that, let's begin our conversation. Very fortunate to have a super panel assembled here this morning. How are you, Laley? Good to see you.
Good to be here.
I will go ahead and make introductions. Everyone knows the panelists, I think, here in a big way. I'll start on the far end with Dr. Virginia Kane. Dr. Kane, of course, is the Director and Chief Medical Officer at the Marion County Public Health Department. Dr. Kane, great to have you.
Thank you
I know
for
you're going to
having
have some great perspective for us. Dr. Jasmine Gonzalvo is the Teresa Demos Director of the Center for Health Excellence, Quality, and Innovation at the Purdue University College of Pharmacy. Dr. Gonzalvo, great to see you as well.
Great to be
Richard
here.
Gordon is Director of Community Engagement at Gleaners, very active in so many things at Gleaners and connecting with community. Ben Grandy is Director of Philanthropy at Glick Philanthropies, and Malali Kennedy is Executive Director at Gennesaret Free Clinics, and great to have you, Malali, as well. I'm going to start on the far end, Dr. Kane, with you. As we were talking at the table, and maybe this can help tee the conversation up a bit, but you recently finished up your community health assessment,
That's correct.
which is really a snapshot of health in the community. What did it find? What are your big takeaways?
So we picked 5 big major health issues identified by 220 different organizations and over 5,000 individual residents from Marion County. The number 1 issue, believe it or not, was mental health. Number 2 was access to health care. But number 3, the first time we've ever seen this in a health assessment that we do every 4 to 5 years, was safe and affordable housing. A social determinant for the first time that we ever saw. And then, of course, number 4 was infant mortality. And 5th had to do with trauma. We're seeing a lot of domestic violence occurring as a result of our situations where basic health needs are not being met by so many people in our community, and the problem is only growing.
Yeah, so mental health, you mentioned that, and the worries about finances and not having enough and where that next meal is coming from, very real.
So the anxiety, the depression, I've got to figure out, we recently had to take care of a young mother who was sleeping in her car with 2 children because she didn't have a place to stay. And the problem is, do I pay for my utilities or do I pay for food? And it's so difficult, and then circumstances can result where you downsize, you lose your job, and now how do I pay for the rent for my home? So this creates a tremendous amount of anxiety, depression, which can impact your children that you're overseeing because they can feel that tension.
Mm-hmm. Yeah, yeah. Malali, as you look at how you have seen things change in recent years, what are you seeing at Gennesaret?
Well, one of the things that we have seen, and Dr. Kane, and as you went down the list of items that were at the top of the community health assessment, one of the things that is not on that list is access to nutritious food. And that's because our community has done an amazing job with Gleaners at the forefront of ensuring that all of our neighbors that need food have access to it. But what we're also seeing is that there are so many other factors, utilities, housing, affordable, and wage that impact our families, and healthcare drops to the bottom. And in the past 5 years, what we've seen is that healthcare has become less and less of a priority for our families as those other issues continue to rise. And that's reflected in the need for better access to healthcare for our community.
I want to remind everyone, we want to make this a conversation, a connection with you in the audience as well. So if you would take a moment as our discussion continues and scan the QR code at your tables and submit questions for our panel. Great opportunity to fire some questions up here of this great panel. So just scan the QR code. I'll get those up here on this trusty iPad, and we'll get those integrated into the conversation as well. You mentioned Housing. Dr. Kane mentioned housing. We do an Innovate Indiana series at IBJ Media and Inside Indiana Business around the state, 9 locations around Indiana, and every location, the number 1 or number 2 issue is housing. Any thoughts on what you'd like to see happen to help solve that housing, what a lot of people say is a housing crisis? What can be done from a housing perspective that would improve the situation?
Yeah, happy to take that one, being in the housing space. Ben Grandy, Glick Philanthropies. I think we're most well known for on the grant making side, but within the Glick Philanthropies umbrella, we have the Glick Housing Foundation. It's a separate 501c3 public charity that's our non-for-profit housing portfolio. About 9,000 units in it, 55 properties across 11 states. And the mission of the Housing Foundation is to acquire, maintain, and preserve quality, affordable housing. And in recent years, a big focus of that and kind of where the intersection with our grant-making work is really supporting resident success. So a lot of the work that Janessa at Gleaners, folks on the panel are doing, partnering with them and really looking at our resident population as, our kind of North Star. How can we pair our grant-making resources with what we're doing on the resident success side? So specific to our partnership with Gleaners that Fred alluded to this morning, Gleaners to Go is at 3 of our apartment communities. So residents can, get on the phone, iPad, computer, order groceries from the comfort of their home. A couple of days later, Gleaners to Go delivers it on site. So when you're thinking about just reducing some of those barriers, whether it's transportation, it's been an amazing partnership. I think last year, about 2,500 grocery deliveries were made across those 3 properties. So just thinking about the impact that has on our residents, the cost savings for the food, just the time saved from going to the grocery. It's been an incredible partnership. And when you're looking at that, being able to free up additional time, freeing up additional resources, when we're thinking about, feeding the line and shortening the line, we see our work very similar to that. The goal of living at an affordable apartment community within the Glick portfolio is, how can that be a springboard to greater opportunity? We want folks to be able to move from affordable to market rate to eventually home ownership. So a lot of the work that our resident success team and some of the folks are here from the team, they're doing is really, identifying residents' needs and goals and helping them reach their goals with the ultimate goal of, can living at a Glick apartment community be a springboard to greater opportunity?
Yeah.
So Dick, can I pipe in here? I really think, it's just mind-boggling, especially in the winter months and, we have these freezes and snow, that we have people that are living in tents, and you say to yourself, how do you not, when it goes below freezing, how are you surviving in these tents out there, as a homeless population? It's just frightening, and, some of them have pets, so they got to sleep together just to get the warmth and pray that they're not found frozen to death. But we're getting $20 million, I believe, the city of Indianapolis for something called low barrier shelters, but we need homes. That means all of our developers out there, home developers, we got anybody out there in the audience? Okay. With those executive tariffs, our costs for so many supplies now for housing is going up tremendously. So I think we have to have some kind of incentives, some tax breaks or some kind of tax credits in order to get developers to build more low affordable housing. And we need that. Other cities have accomplished this. Detroit, other places. And of the best city in the world who knows how to do collaboration, it's Indianapolis. Yeah. So there's no way we can't figure this out in order to increase the housing for the people who need it. Because our shelters are full.
Mm-hmm. Yeah, you mentioned collaboration, Dr. Kane, you mentioned Detroit. Are there other cities or communities doing things?
San Diego, California is a location that's doing things. So they're coming up with some wonderful resources in order to build these houses. Now, they had an advantage. Cost a lot less when they built their houses than if we have to build them now. But hey, we got the brightest minds in here, okay? We got philanthropy in here. And so and we got people who will volunteer their services. I have a construction company. I may not have the money, but I'm going to volunteer my staff to help do this or build this. Like, Habitat for Humanity. We can make it happen.
Yeah, yeah. Dr. Gonzalvo, a lot is being talked about, certainly in the news and the headlines on prescription drug prices and their impact on the economy and individuals overall. How can pharmacists, healthcare providers, and others be involved more directly in this food insecurity issue? Are there things that you see that can happen, or collaborations or things that can help the cause?
Well, I hope everybody knows by now that we have a charitable pharmacy on site at Gleaners in the resource room. And the collaboration came about with my friend Richard here and our good relationships with the Purdue College of Pharmacy and the work that we've done during the pandemic, offering vaccines in the line. So people were getting their food and they were getting vaccines. We grew that relationship and trust and now have an on-site brick and mortar charitable pharmacy on-site at Gleaners. We opened in November with a soft opening, and in what's right around being open for 60 hours for our soft opening, we have filled right around 100 prescriptions and saved people over $30,000. So while we're focusing on food insecurity, shortening the line, the place that I'd really like to make a difference is medication insecurity. And our pharmacy, the charitable pharmacy, is a licensed pharmacy. We have first-line medications. We have the best medications. We have the best insulin. So we're not talking about creating health disparities by providing whatever medication is available. We're providing the best medications for people who don't have medication insurance and are at or below 300% of the federal poverty level. So we're bringing medications to a place that's serving thousands of people every week, and we're doing it well. And the quotes that Fred put up earlier really spoke to the work that the pharmacy is doing. We're serving the stories that I'm witnessing and hearing through the pharmacy. We're doing it one person at a time, and it's such an honor and opportunity to be up here with these people and partners to be addressing food and medication insecurity together. And I'm really hopeful. We've only been open since November, but we are quickly expanding our hours. Those numbers I gave you are open hours that aren't even necessarily aligned with pantry open hours, because we had to tiptoe in so that we didn't make any big missteps. But we're very shortly opening during those Thursday evening hours and those Saturday times, and I think that's when we're really going to see the numbers climb. But again, just the opportunity, the relationship to address both food and medication insecurity, I think, is a real asset to the communities served by Gleaners.
Give folks an idea, if you would, on how food insecurity really complicates medication management, chronic disease care, those types of things.
I have spent my 20-year career primarily in diabetes. I have some of my best colleagues here that I've worked with in diabetes. And so when we're talking about food access and medication access and how, for example, somebody with diabetes, if they don't have adequate food, if they don't have adequate nutritious food, and they have inconsistent access to medications or are unable to afford medications, you better believe they're going to the hospital. They're unable to care for themselves adequately. They're developing complications, and what goes along with diabetes is hypertension, cholesterol, and now we have if an inability to secure food and medications is essentially creating a ticking time bomb for that person to have cardiovascular complications in the hospital and raise medical costs. So when we're able to do that together at Gleaners, we're doing a lot for the community, we're doing a lot for the economy.
Yeah. Richard at Gleaners and Fred, as he always does, really teed up our conversation with some great numbers. But what are you seeing on the ground there at Gleaners, and how has demand changed and impacted the way you do business?
Well, first and foremost, we are seeing on the ground at Gleaners. First of all, I want to thank all our partners here, because we couldn't do what we do every day in and day out with the great collaboration, as Dr. Kane said, to be able to do it. But to answer your question more, Gary, said that we are actually seeing more and more neighbors in need. of resources. And it's not just what you think of folks who you may think of as being traditionally underserved, it's also those people who are working but just don't have enough to make ends meet at the end of the day. And so, being able to work with these partners is really helpful. And one thing I wanted to point out real quickly, if I may, when we talk about the services that we have been able to work together, we actually talk to our neighbors. Now, you may think that's simple, but really be intentional about talking to our neighbors. When we talked about, Jasmine and I, going back at several of us, talking about pharmacy and the need, we actually went out and did surveys, quantitative and qualitative analysis. My wife always gets on me because she's a scientist about that stuff. But just talking to our neighbors and finding out what types of, if you're dealing with the need for a pharmacy and access, what are some of the issues that preclude access? What are some of the drugs that you have trouble accessing? And you have someone with a can-do spirit, like Jasmine and her team. We went and got the information, made an informed decision, and we were able to bring something here that's positive. So
Very good.
I'd answer a little more, but I wanted to get that in there too.
Yeah, good. Well, we have a question as a follow-up, Dr. Gonzalvo, from the audience. Does the pharmacy assist with specialty drugs?
Oh,
Is that it?
Pharmacists, so when we think of specialty medications in pharmacy, I automatically think, oh, those are the expensive ones.
Right.
And so if we're talking true specialty drugs, not yet. But if we're talking some expensive medications, we for sure have some expensive medications. But when we're thinking specialty pharmacy, we're not quite there yet. I hope to get there one day. I have huge aspirations for supplying the expensive medications.
Right.
And I'll say some of the advocacy work that we're trying to do is set up, I'm really trying to lead this for the state, is the drug repository, meaning that we can get specialty drugs donated to us that are either from long-term care facilities or from people who don't have a use for those medications anymore, that they would legally have an avenue to donate them to the pharmacy, and then we'd be able to dispense specialty medications. So whoever asked that question, I hope to very soon, in the very near future.
Yeah. As a follow-up to that, the things that are being done on the national level that we're hearing about from a prescription drug pricing standpoint, what are your thoughts on that? How do you look at that and impacting?
Isn't that a loaded question?
I know.
What are my thoughts on drug pricing? So I'm going to keep it very short. I have a lot of thoughts about drug pricing, but what I do know is that even for us in this room, for me, medications are expensive, and we don't know, the general public doesn't always know how to navigate to a better price. So the things that we're working on, we are advocating for tools. I have a tool, an AI tool that's going to help navigate people to more affordable medications. So not only are we doing medication access through the charitable pharmacy, but also through developing tools to help the general public afford medications. So what I know as a Purdue pharmacy faculty professor is that we as a profession have to do our job to help people afford medications, because it's not coming from the PBMs, it's not coming from the manufacturers. And so pharmacists have to be really qualified and trained well to help people navigate those barriers now. We can't wait for the PBM reform to happen, although, George, I'm looking at you, we're trying our best for the PBM reform, right? But right now, you have pharmacists who can help you navigate to better drug prices, and that's part of my focus in training Purdue pharmacy students to be better able to navigate that landscape, because it's super complicated. So, so many layers to drug pricing and drug affordability, but what we are doing at the charitable pharmacy at Gleaners is, if you don't have medication insurance and if you meet those eligibility guidelines, you get your medications for free, and you get good medications, and we're doing our best to take care of the Gleaners community.
Good.
So I want you to understand where the prices of the prescriptions are coming from. I want you to remember this number, 340B. 340B means that the government has got an agreement with most of industry to provide their products at a very low cost for residents or patients who are eligible. So if you know your Medicaid kind of clients or whatever, you can get a industry drug that retails at, wow, maybe $200 or $50. You can get it for like $20 or $15. The problem is that we now have healthcare systems, because of a loophole, are able to get all of those discounted drugs through all of their hospital systems, and not necessarily for their hospitals that have a high percentage of eligible clients. And so with so many people delving in, taking advantage of this money, industry says, hey, I didn't mind giving my product, for people who really need it and necessary, but I don't want healthcare systems making a profit off my drugs for patients that don't meet the criteria. Huge fight taking place on the state level, national level. Watch the 340B. Pay attention to it, because it's going to make a difference about the cost of all of our prescriptions, all of our medications.
And I'd like to just bring home what that means for our families. At Gennesaret, what we're seeing is individuals that are coming in that are insured, but they can't meet their deductible. They can't meet their co-pays. The out-of-pocket expense is too high. We have over 30% of those that come in are aware of their medical condition, but have not been able to be treated in a year or more due to cost. Over 60% of our patient population has a prescription that they have either not been taking at all or are not adhering to due to cost. These are the choices that our families are having to make. And our goal, and I think what we do really well, is ensure that we are able to meet the needs of our individuals and families all in one location, so that they are not having to make these tough decisions between access to food and paying for their housing. Because these medical costs, the medication costs, those are the things that often fall to the end of the line for them in making those decisions.
And I'll just point out too, you mentioned we were talking about access, not talking about cost, but access in terms of physical location. There's a such thing as a pharmacy desert. And so when we talk about that, especially in many of our areas that might be underserved, people don't have access or places to go get or nowhere to go get those meds. So being innovative, looking at ways to have things like the charitable pharmacy where neighbors are coming in the clinic at Gleaners are just really good ways to help in that effort. But that's something we've got to look at as well when we talk about access. And I know some are more versed to speak to that than others. And it's not just an urban issue. It's also a rural issue as well when we talk about access points for our neighbors to get access to affordable medications. Because that's in hampering the line.
Can you expand on that? Because the rural issue, we get around the state, and certainly issue here in central Indiana, but it very much is a statewide issue we're talking about.
Yeah, I mean, sometimes the issue is when we talk about with our neighbors is communication. There may be infrastructure, but how are we connecting them to those resources? Sometimes in our rural community, that infrastructure isn't even there. And so a lot of times those individuals may not necessarily have help or know any help or know where to go to get that because they don't have that community safety net structure, if you will, infrastructure that is built in that community, especially when we're talking about access to low income charitable medications that they can get.
Yeah. Okay, in terms of shortening the line, how do you shorten the line? What do you do? It sounds to me like certainly collaboration is a big part of that. Charitable pharmacy collaboration, an example of collaboration. Mulayli, we were talking at breakfast that collaboration is a big part of what you're doing and benefiting from now. Be interested in anyone chiming in on this in terms of how you see collaboration shortening the line. But Mulayli at Gennesaret, talk about the collaborations and the impact they're having.
One of the things that we realized at Gennesaret is that we needed to be where our residents were at, right? We have barriers to transportation, time, cost, all of those things that prevent individuals from getting to medical care. So we started to look at how can we collaborate with others to ensure that we are bringing that health care to those areas where we know our residents are going to be. Primarily, that's been access to food. That's a primary need for our families. So with food being such a big impact on community health, it makes sense to bring that health care to those locations. So the Tom and Julie Wood Resource Center at Gleaners was the perfect example of what Gennesaret was trying to do to meet the needs of community, which is to be right there, co-located with all of the wraparound services that a family would need, all in one spot. We were talking about transportation and access to care, especially in Marion County. We have a lot, there's a large area. And so a lack of transportation plays a large part in being able to get to healthcare, being able to get to pharmacies, our partnership with GLIC, and being able to bring our mobile medical clinic out to Carriage House East, an area that is a pharmacy desert, is a healthcare desert, a food desert, like all of those things on the far east side of Indianapolis, was really important to us. So that when the pantry is open and when families are picking up their Gleaners to go, they also have access to our mobile medical clinic right there on site. And these are the ways that we can collaborate to break down those barriers for individuals that have just a myriad of barriers and constraints that keep them from being able to meet their family's needs.
Question from the audience, again, in terms of shortening the line, and it sounds like this is someone from the technology community. Is there a role for technology in this equation, if you will, to play, or the technology community to better engage in the process?
I think I'll take a shot at that.
Yeah.
Okay. One of the things, and we did a study several years ago called The Voice of Our Neighbor, where we looked at what are some of the issues that people find themselves, why do they find themselves in the line? And what are some of the things that might be helpful, much of what has been discussed here today, to help reduce dependence upon the line. But not only did we do that, we also asked, how's the best way we can communicate with you? And one of the things you talk about technology is service providers looking at how you can use something really simple as text messaging to get information out. People do tap into that. So a number of times when we did community surveys and we got a great response rate, we've done that. When we have different activities, our events, we have hours to let people know, hey, we're open today. Using things like with innovation to text people. But also the other way is just really look at outside the box on how. But first and foremost, I think the most important thing is listening to your audience. In this case, it's our neighbor, and asking them what are the best ways. If technology is one, what type of technology? And they told us text messaging has been an efficient way to keep connected.
Mm-hmm.
Now,
Yep.
I'm gonna disillusion you guys a little bit, okay? The disillusion is she's talking about shortening the line. Well, just a year ago, we had about 300,000 individuals got pulled off the Medicaid rolls. It was not because of eligibility, it was because of procedural errors that they were removed from Medicaid, 300,000 last year. But now let's talk about the fact that we're changing the criteria for eligibility for Medicaid. Indiana may rank 4th in the country, having the most people taken off of Medicaid. That's going to be a challenge. Those numbers are going to increase. We do the WIC program, Women, Infant, and Children, where we provide formula, okay? And just a great partnership. We're now have a mobile unit here at Gleaners, where we're here every 2 Tuesdays out of the month for 2 hours, and on Saturdays, 2 Saturdays from, I believe, 9 to 12, where we can provide free formula for eligible clients, help them breastfeed, provide breast pumps and whatever. But we were at 31,500 women and children clients in 2023. 31,500. We are already currently now at 36,000. And the 36,000, a lot of times we have to see them on a monthly basis, so you multiply that times 12. And if we're having more folks unenrolled off of Medicaid, that need is only going to get greater. The challenge is only going to get greater for the gleaners, all of the collaborators to help meet this need. It is scary, it is frightening, but we're going to need everybody's help to make this possible. So that's why the efficiency, the collaboration, the type of partners we have. And here's the beauty about our partnership. I want to say this. We have a program called Fresh Bucks. We give like $250 per month to an eligible Medicaid client to buy more fruits and vegetables for the family. So when you're partnering with us, you get to learn about some of the other programs that we can offer for the clients that are coming here at Gleaners that they might not otherwise know. And we can think of all different type of programs we can add here. We got a gentleman too now. Okay. Thank you.
Good one. Maybe a follow-up from the audience question. A lot of charitable organizations working to be a solution to poverty have seen funding cuts, many of those trickling down from federal and state levels to local funding. What are your thoughts on how the community can help address some of these organizations who are trying to address poverty, deal with some of these cuts?
Yeah, I mean, obviously, philanthropy is not going to be able to fill some of the gaps that's been left by the government. But it does feel like foundations in the nonprofit sector are starting to collaborate more and work together. I'm glad Leila brought up the partnership we have with Genessaret, coming on site to Carriage House East, pairing that with the same day as on-site food pantry when residents are there. I know Midwest and Second Helpings are in the room, great partners there. And it seems like folks are stopping working in their silos, and just by, kind of the crisis in the sector right now, folks are having to get more creative, having to work together, taking off some of the competitiveness for funding, all going for the same pools of funding. Just knowing how great the need is in the community and what we saw last year and this year, that need isn't going away. Some of the numbers that Fred shared show that food insecurity is at an all-time high, and continues to climb each year. So collaboration's more important now than ever, and would encourage folks in this room that approach conversations with an open mind. Organizations don't have to take credit for the work, but really looking into partnerships in places you may not have previously thought.
Yeah. Dr. Gonzalvo, one for you. Will more charitable pharmacies open in other locations? I know this is a new concept here, but that model.
I love it.
Yeah.
I love it.
We'll talk about that. And is this a model that can be replicated in other places?
What a beautiful segue. So a couple of things. I want to answer the initial question that was asked to beautiful people are coming out of the woodwork to support our pharmacy. Our pharmacy is called the Purdue Patterson McCallum Moretta Charitable Pharmacy, and those are the names of people who are private donors who are supporting our work, who really believe in what we do. I had a half-hour meeting and got the vast majority of our funding from that half hour because it's very easy to understand the need that we're trying to fill. The segue is there's a half sheet of paper on all of your tables with 2 QR codes. One of them is to vote for us in the Project for Awesome. The more votes that we get, the more funding that we get. And you can later watch our video. It's like a 3-minute video on the work that we do. On that half sheet is also another QR code that shows all of the medications that we have available, if any of you find that listing helpful for the organizations that you work for. So Can you repeat the second question?
Yeah, the potential for additional
Oh,
locations.
yes. So this is also goes back to the technology. I got excited about that one too. I'm very excitable. So medication lockers are the next thing I'm really excited about. So we have a really good relationship with St. Vincent de Paul as well. And so in other states, what we're seeing is you can have medication lockers and people have apps that they say, oh, your medication is available in B46 at St. Vincent de Paul. You have an app, you say, open my locker. We have delivered them all to those lockers and they can pick up their medications at other places. So my pie in the sky vision, even though we've been open for 3 months, is to have a bunch of medication lockers around not only central Indiana, but across, like Sarah, Estelle, and I were talking about, and Mary, I think Mary Davinian too. Is Mary here?
No.
Oh, sad.
Okay.
But we were talking about potentially using the power of Gleaners distribution and trucks and supply chain to potentially one day help supply these lockers and medications. So we are very much thinking about expanding our reach and scale. So that's technology, that's scaling, that's reaching more populations. So it's definitely something that we're looking into, again, hopefully in the near future.
Can I do full disclosure? So I get my TB medications from Purdue Pharmacy, okay? And so we might be interested in that model you were just talking about the lockers.
Okay.
Because we have to do directly observed therapy for everybody to take their TB medicines. We have to send out a community health worker. They have to watch them take their medicines for every client. But hey, I mean, if I could get medication lockers and they can go and get it themselves.
Let's do it, Dr. King.
I think
Let's
so.
do
That's
it.
right.
Good.
Okay. Sounds
Got a
good to
deal
me.
in the works right here. Very good. Another question from the audience, and I don't know who wants this one. What is one program that has involved multiple organizations that has improved food security, and what can we learn from that program to scale impact? An example of one program in particular that a collaboration among multiple.
Oh, well, that's just simple. That's why we're here on this panel, right?
Yeah.
Yeah.
I mean, Gleaners.
Yeah.
I mean, what
Yeah.
organization have you seen with the number of partners, what we're doing out there? And listen, we are educating the public. So, you know, what I love is, you know, I may be from Nicaragua or Honduras. I can come up and get some food that's culturally that I don't mind getting. You know, you can give food away, but if it's something, I never eat that kind of food or whatever, it's a waste. But we also want it to be nutritious too as well. I don't want to get some really high salt content and I've got high blood pressure. But I think it's the level of collaboration here from Gleaners that I've just never seen all. You know, you want that one place. Because we got transportation issues. Where can I go get medical care? Where can I go and get food insecurity? But I can also get so many other services, medical care, okay? And you can learn about other resources that are available out there in an easy and simple way. This has got to be one of the best told stories. I was just telling Fred, I met a gentleman in Minnesota who was telling me how wonderful Gleaners was. And I said, well, you won't believe I'm from Indiana. And I know about this program.
Yeah.
So it's just a great national model that we should have duplicated in so many places in the state of Indiana. Because like you said, some communities, rural communities, they don't have this level of resources, collaboration. And so I just think we need to tell our story better in order to create more models like this across the country.
And I'll just tap in on that. I think Dr. King said some wonderful things there, and I totally agree. It's all of us working together. We all have strengths. There's some things that, hey, we can't do because we're not in the medical field, but hey, we've got great partners here. That if we collaborate and work together, we can do something. And hopefully all those roads should lead to the benefit of the neighbor. I like to say, and my colleagues here know, I always talk about Joe and Jane Hoosier. That's where all roads go. And if we're working together, managing the collaborative relationship together, because it's not just, oh, we do one thing, it's a relationship. And as we continue, we keep the neighbor at the forefront of it all, I think that brings about great impact by and by.
Yeah, when you talk about this issue, this was another question that I jotted down. Should hunger be viewed as an investment issue and not just a moral issue? So an investment in trying to come up with solutions. Your thoughts on that?
This certainly is an investment. It's an investment in our community and in our residents. And it should not be unique. Like what we are doing at the Tom and Julie Wood Resource Center at Gleaners should be the norm within communities. It should not be unique. There is such an opportunity to be able to replicate what we have accomplished and what we have all been able to do together at the center in other areas across Marion County, across the state of Indiana. And it really is an investment that pays off. Ensuring that residents can see a provider and walk out that door after hearing about how to treat their chronic disease into an area where they can then choose the food, the healthy, nutritious food that their doctor has recommended for them to be able to eat, and then to be able to get their medication so that they have that prescription and all of the other resources so that they can help to manage their mental health, their stress, their lives, all of the things that are keeping them from thriving, all in one location. That really lowers the cost. It lowers the cost of healthcare. It lowers the cost for our larger healthcare institutions who too often see people in their emergency rooms or as inpatients that really just needed better access and preventive services. And so this is the perfect opportunity for us to be able to showcase how well an investment can impact on the community. And so I for one, at Gennesaret, and I know all of our partners, we are already thinking about like what's next, like where are we going from here? And we need that investment and that support to be able to do that.
Yep, one more question from the audience here. Those on the panel here, a great example of collaborators working together. Is there, or should there be, a formal body or organization coordinating to create synergy among collaborators to make sure all the arrows are pointed in the same direction, everyone's rowing in the same direction? Thoughts on that?
So I think on some level, yes. And let me just say for our 5 health issues, we're trying to do what they call community improvement plans and trying to address those issues from a whole collaborative standpoint. But, you know, how do I convene a lot of construction developers to say we need low affordable housing? How do we make that happen, and who should be at the table in order to do something like that? We still always have to have some leadership from the city of Indianapolis, you know, having some input related to this, but it's just difficult to say because you got some innovative folks who know how to collaborate. They used to be doing it. And so you get the right person and to get the right program. One person, just one person can make a difference in the lives of everybody in the community. One person. How many people do we have in this room here?
Over 100.
Several hundred.
One person can make a huge, amazing difference. And look at all the folks we have in this room. Let's get these names down, Fred, okay?
That's good.
Let's get this coalition going.
Yeah.
Let's get it moving, whoever made that suggestion.
Okay, want to give everyone a chance as we wrap up here. Takeaways we've got a great group here, diverse group of community leaders in the room here, but as we talk about shortening the line, and Dr. Kane, we'll start with you. Is there one thing you'd like folks to take away from this in terms of how we as a community can shorten the line?
Well, I think the one thing is, and I'm sorry about the children. We want to invest in our children. We want them to be healthy. We want them when they go to school, they're not tired or hungry, exhausted, that they cannot learn. And this is going to be our future generation. What are we doing to instill our values that we can have healthy children, growing children, that's going to make a huge difference in our community? And so I ask all of you, do your part. You have to give a little bit extra now. This is a really challenging political landscape. And so we have to give a little bit extra more than what we normally do. But if anybody can do it, it's the folks here in this audience, because you're used to trying to find resources. You're used to problem solving. And there's so many ways how we can make this happen, and you can make a difference, and that's all I ask of you.
Good, very well. Dr. Gonzalo?
Yeah, I'll say there's everybody up here, everybody who I've worked with at Gleaners for as long as we've collaborated, the part that really resonates with me and has resonated with me is that we walk the walk. There's so many people, even if we convene and then we talk and we have a great conversation, we have great ideas, we're at a time where we have to walk the walk. And there's so many people in here who doesn't even, I mean, yes, vote for us, but like also whatever your area of expertise, wherever your heart pulls you to do good, the time is now to walk the walk and do good. So that's the takeaway for me for shortening the line. It is, at least from the perspective of the pharmacy, people need to be present, not absent for the economy. And what we're doing at Gleaners by providing increased access to healthcare, medicine, food, we are taking care of people, improving health outcomes in the communities who need it the most. So we're taking care of communities and the economy. And there's a huge investment that's needed to continue to do that. But my ask and my takeaway for today is walk the walk in all of your specific spaces.
Good.
And food is medicine.
Yeah.
Food is medicine.
Good. Richard?
A couple things. First, real quickly, I'm going to deviate. I want to thank first the Gleaners team, being a part of a great team, our leadership, our outreach team. We couldn't do it, but also all the people here on this panel. We couldn't do that. But one thing I will say is to really, first and foremost, and it sounds simple, but it's so important, is keeping the neighbor first and not paying lip service to that. Listen to them. They know. We may think we know all the time, but sometimes it's really listening. How can we better serve you? And coming at it with a servant leader heart. And then let that information help dictate the strategies and types of collaborations you build. And that's something we try to aspire to. So keep the neighbor, Joe and Jane Hoosier, at the forefront of it all and be intentional when you do so.
Good.
It's not a new line, but Fred mentioned earlier, Gleaners isn't in the food space, but the poverty alleviation space. And when I heard him say that a few years ago, that really helped shift some of my mindset on the work. And when we're investing in various basic needs, not thinking about the specific outcomes of that one grant or one organization, but how collectively, that can have a tremendous impact on individuals and families. If it's, Indiana Diaper Bank or Project Period or a number of our partners that, on a case-by-case basis, may feel like a smaller impact. When you add all that up, some of the disposable income you're freeing up for families who are then able to, purchase a vehicle, purchase their first home, whatever that might be. The small acts add up and make a tremendous difference. So continue investing in those organizations and, continue to uplift the folks that are doing some really great work, like everyone on this panel here.
Good.
I think the one takeaway here is really actually the title of this breakfast, Hunger and Health, in that intersection. And each of you play a vital role in where hunger and health intersect. And your participation is needed. At a local level, with each of our residents, they have a really specific need for them and their family. And being able to hear that and acknowledge that and begin to address those needs, I think is the first step for all of us. I think there are so many creative, innovative minds here in this room that all have unique ways to be able to impact this intersection between hunger and health. And we are all just poised to do amazing things together. And this is the time to do it, now more than ever. I think you've heard some great statistics today, but those numbers are reflected in real people. People that are just trying every day to do what they can for their families. And if we all have this goal to ensure that every resident has the opportunity to thrive, then we're gonna just keep on doing all of the amazing work together. So I thank all of you for your partnership. Gennesaret has become such an institution, and we've been able to elevate our work because of everyone on this panel, and especially our work with Gleaners. And we just want to keep going.
Well said, well said. Indianapolis has certainly benefited for many years from great leaders, great leadership, and I think that's reflected certainly in the panel today, and for many of you in the audience as well, as we look to shorten the line. How about a big round of applause for a super panel? Thank you all. Thank you.
Well, Gary, thank you. To the panelists, thank you. There are so many calls to action. One of the greatest things that we talked about when we got together this morning is we're here to link arms. And as Fred and I were talking, I said, Fred, what is the thing? Right, what do you want me to tell these people to go do? Everyone's fired up. We're armed with information. We're fueled by passion. And he said, look, this is really simple. Be you. Engage where you are. Everyone in here, every single person in this room is united by a passion to combat food insecurity. Everyone in here can make a difference. I love, Dr. Kane, what you said, right? That every person in here has the opportunity to affect life change. And my challenge to all of you, to all of us, is how today do we take the next step in changing lives? Whether that's hunger, whether that's wherever it is you serve, just engage. And I know Fred and the team at Gleaners, thank you for your partnership. Thanks for making this morning possible. Also, thanks for your leadership. If you want to engage with Gleaners, I'm sure that there's a lot of distance between Fred and that door. So whoever wants to come see Fred, he would love to have a conversation with you. And my friend Jasmine would also love, there are QR codes, right? See, I'm doing the pitch for you. Two QR codes at your table. She's got a video she'd love for you to watch. She'd also love for you to vote for her so we can get medicine to those neighbors who need it. Sincerely, on behalf of the entire IBJ media team, Gary, Dick, our entire crew, Fred and the Gleaners crew, the 140 employees that make Gleaners happen each and every day, thank you for your work. Thanks for being here. Make it a great day. Thanks so much.